Let's go over what you need to know about the skills test and the exam for your BLS course. To earn your BLS course completion card, you must pass 2 skills tests. During the course, you will practice chest compression, bag mask ventilation, and using an AED. Afterward, your instructor will test your skills using a brief scenario. You will need to respond as if it's a real emergency without any coaching or help during the test. Now about the written exam. It's open source and open book. That means while taking the exam, you are allowed to use any printed or digital material you have. This could include your class notes, the provider manual, or the American Heart Association's handbook. But you're not allowed to talk about the exam questions with other students or with your instructor. I want to say you don't worry if you are participating and actively listening during the course. Both the skill evaluation and written exam are very easy to pass. Before discussing the topics, let's go over some important abbreviations you will encounter through the BLS course. These terms are essential for understanding procedures, equipment, and communication during emergencies. BLS stands for Basic Life Support. AED is Automated External Defibrillator. PPE means Personal Protective Equipment. PVT is Pulseless Ventricular Tachycardia. CPR stands for Cardiopulmonary Resuscitation. ED refers to the emergency department. TCPR is Telecommunicator Assisted CPR. ECG stands for electrocardiogram. LUD means lateral uterine displacement. EMS stands for Emergency Medical Services. PAD is Public Access Defibrillation. ROCK or ROSC is Return of Spontaneous Circulation. AP stands for Anteroposterior, and CCF stands for Chest Compression Fraction. Let's talk about Personal Protective Equipment or PPE. This is what keeps us as rescuers safe from health and safety risks while we are responding to emergencies. The type of PPE you will need can vary depending on the situation and the protocols where you work or volunteer. It can include things like medical gloves, eye protection, gowns or full body suits, high visibility clothing to make the wearer more easily seen, especially in low light, safety footwear, and helmets. Now let's discuss about age definitions. For BLS course, age definitions are as follows. Infant is younger than 1 year of age, excluding newly born infants in the delivery room. Adults or adolescents is defined as after the onset of puberty and older. Children are 1 year of age to puberty. Signs of puberty are chest or underarm hair in males and any breast development in females. Now let's talk about the term chain of survival. The chain of survival is a helpful way to understand the key steps involved in emergency cardiovascular care. Think of it as a series of connection actions that must happen quickly and effectively to give a person in cardiac arrest the best possible chance of survival. Each step or link plays a critical role, and while each one works independently, they are all tightly connected to the ones before and after. If any one of these links fails or is delayed, the overall chances of a successful outcome go down significantly. That's why every part of the chain matters. Cardiac arrest can happen anywhere, on the street, at home, in an emergency department, in an inpatient bed, or even in the intensive care unit. Because of this, the way we respond and the order of actions in the chain of survival will vary depending on where the arrest occurs and who the victim is. The care provided is different for adults compared to children or infants. And it's also different depending on whether the cardiac arrest happens inside a hospital or out in the community. So actions in the chain of survival are not one size fits all. They change based on both the setting and the age of the victim. Specifically, we recognize four main chain of survivals: pediatric in-hospital cardiac arrest, pediatric out-of-hospital cardiac arrest, adult in-hospital cardiac arrest, and adult out-of-hospital cardiac arrest. Each chain is tailored to the situation to ensure the best change of survival. I won't go into great detail about this image or the chain of survival right now because we will cover that thoroughly in the next slide. I just want to highlight one key point. For adult out-of-hospital cardiac arrest, the third step is defibrillation. This is the main difference. The recovery and post-cardiac arrest care are always the final two steps regardless. I created this visual to help illustrate the chain of survival, which represents the steps we need to follow during a cardiac arrest, whether pediatric or adult. Again, I won't discuss this in depth here since it will be covered later. Prevention and preparedness are really the backbone of recognizing cardiac arrest early and responding quickly. Most out-of-hospital cardiac arrests in adults happen unexpectedly, usually at home. Make sure to remember this because you may see that during the exam. The key to better outcomes is starting high-quality CPR right away and getting a defibrillator during first crucial minutes. That's why community programs that train people to act fast are so important. One of which is this video. Prevention means helping individuals and communities stay healthier overall, while preparedness is about raising awareness and teaching people how to spot the signs of a heart attack or cardiac arrest and to respond efficiently. Things like CPR training for the public and developing strong emergency response system make a big difference. Plus, emergency dispatchers play a huge role by guiding callers through CPR over the phone, which increases the chances that bystanders will jump in and help. Technology helps too. Mobile application can show the closest AEDs that are available. Public access defibrillation programs put AEDs in places where people can get to them quickly and teach people how to use them, which saves lives by cutting down the time to defibrillation. Inside the hospital, preparedness means spotting patients who might need help before they go into cardiac arrest and acting fast. Most in-hospital arrests happens because of the worsening breathing or circulation problems. Doctors and nurses can often catch these signs early and prevent the arrest from happening by carefully monitoring and timely treatment. When cardiac arrest does happen, the response has to be immediate, activating the emergency team, starting CPR right away, and using the defibrillator as fast as possible. Many hospitals have ongoing training programs and special rapid response teams to make sure everyone is ready when seconds count. There is an important difference between adults and kids when it comes to cardiac arrest. Adults usually have sudden cardiac arrest caused by heart problems, but in children it's often because of breathing failure or shock, which are just as serious. Please make sure to remember this because you may see them during the exam. For kids, preventing cardiac arrest starts with recognizing and treating these breathing or circulation issues early. Catching these problems before they get worse can really improve a child's chances of survival. You can see I included images of AED devices that can be mounted on walls or placed in the middle of the parks where emergencies might occur. When we will start discussing the BLS protocols, we will say, activate the emergency response system. What that means? Activating the emergency response system out of hospital usually means shouting for help and calling 911 or the local emergency number. In workplaces, everyone should know how to do this because the sooner it's activated, the faster the help arrives. It may be a button that needs to be pushed or a phone number that needs to be called. In hospitals, activation depends on the instructions protocols. A provider may call a code, collect a rapid response or medical emergency team, or ask someone else to do so. Acting quickly ensures the next level of care arrives sooner. Advanced resuscitation interventions performed by trained providers both out of hospital and in hospital include gaining vascular access, administering medications, placing advanced airways, obtaining a 12-lead ECG, and starting advanced cardiac monitoring. High-quality CPR and defibrillation remains the foundation for success. In out-of-hospital settings, a bystanders provide CPR and use an AED until a multi-rescue team arrives, who then continue those efforts and add advanced interventions. In hospital, teams include physicians, nurses, respiratory therapists, pharmacists, and others, and may use extracorporeal CPR in specific cases. You can see the image that shows extracorporeal CPR, which is an advanced life-saving technique that uses a machine to take over the functions of the heart and lungs during resuscitation, providing critical support when traditional CPR is insufficient. After return of spontaneous circulation, post-cardiac arrest care begins immediately, even out in the field, and continues through transport to the hospital. This care includes critical care like maintaining ventilation and stable blood pressure, helping to stabilize the patient early on. Once in the hospital, a multidisciplinary team takes over, targeting on preventing another arrest and tailoring therapies to give the patient the best chance at long-term recovery. Post-cardiac arrest care can take place in emergency department, cath lab, intensive care unit, or coronary care unit, depending on the patient's condition. Some patients may undergo a cardiac catheterization procedure where a catheter is inserted through the groin or wrist and guided to the heart to evaluate and potentially treat issues like blocked arteries. Recovery doesn't end at the hospital discharge. Survivors may need specific treatments to address the cause of the arrest or the start cardiac rehabilitation. Some will need neurological rehabilitation, especially if there was a delay in restoring circulation. Emotional and psychological support is also a major part of recovery, both for the patient and their family. Even rescuers can benefit from psychological care after a high-stress event like this. Now let's learn how to perform high-quality CPR both on your own and as a part of a team. So when we say adult BLS skills, this applies to anyone who's had the onset of puberty or older. CPR can be done by anyone, and your role as a rescuer depends on a few factors like your training, your experience, and how confident you are. It also depends on whether the victim is an adult or a child, what equipment is nearby, and whether you're alone or with others. If you're alone and not highly trained or don't have equipment, hands-only CPR is a solid option. If you have more training, you can do 30 compressions in 2 breaths. And if there is a team of rescuers, you can work together using coordinated multi-rescuer CPR. When multiple rescuers are involved, coordinating tasks as a team can increase the chances of a successful outcome. High-performance rescue teams divide responsibilities so each member can stay concentrated and deliver effective care. Your goal as a part of that team is to bring your best CPR skills and contribute to the overall effort. The core components of CPR remains the same: chest compressions, airway, and breathing.